Okay, let's go over some of the sports massage techniques for the lower body to start with. So what we're actually going to do for here is you can actually plantar flex, bringing the foot down. As you can see, you can plantar flex. So we're going to plantar flex, bring the foot down, and gliding up for the tibialis anterior region. So the tibia bone, just lateral to that, is the tibialis anterior. So the ratchet technique, remember we went over that one? So plantar flexion slide, extension nothing. 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 Or you can actually perform one gliding technique up the whole side of the leg then. But just make sure again it's not on the tibia bone at all. Make sure it's on more just lateral to that then. You can also rotate, pull the foot towards you, but stop before you hit the tibia bone. So just make sure you stop before you hit the tibia bone. Those techniques, you can actually rotate the whole foot then. But again, anytime you're actually performing these techniques, it's actually a little bit easier so you can actually get a little bit more pressure. Because that's a big complaint out in the field, that you're not getting enough pressure for the client. So sometimes the client will actually participate a little bit more with these techniques. Okay, next one. What you can do is you can cup the calcaneus here, the heel, and I'm actually going to dorsiflexion it. You can dorsiflexion it and contract the muscle more. So I'm actually going up towards the knee, so you can get pressure on either side of the shin region. Or again, just like we did before, but you can actually both sides go up, kind of squeeze, but not on the tibia. Okay, especially for problems with cramps in the feet, if they ever develop any of those, you can actually kind of rotate and twist, or you can actually massage that area too then, okay? So more of an opposite movement for that region. Okay, next one, I'm actually going to extend the toes and go down the foot. So extend the toes, go down the foot, so you can add a little bit more pressure that way. Or you can actually use your knuckle going down, or all your knuckles. So extend, go down. Or you can actually rotate the foot towards you and go across, so it gives a little bit more resistance. So I'm rotating it towards me, and going across, or you can rotate it across and pull towards you with the technique. And with the toes, you can actually just kind of pull and hold and do a little traction for that region. Works out nice. Otherwise, you can traction and twist for the toe region. Or you can separate it too. But just, especially with the athletes, you actually want to look in between the toes and make sure they don't have any athlete's foot. So it's just going to be uncomfortable if you actually extend the toes like that. So that actual action is called abduction, abduction. So it goes away, so you're opening that area up. Okay, next one, I'm going to go underneath the calf region and actually have them try to push down on the table with their foot. Now I'm going to kind of slowly rotate out. So lift it up again and try to have them push down on the table, like that. Okay, next one, I'm going to lift underneath both sides and have them push down on the table and slowly slide out. And if you want, each time, you can actually make it a little bit deeper. So this is actually incorporating a little bit deeper pressure into the treatment. Next one, you actually have your forearm underneath here. You can kind of rotate around, see if you want a little bit more pressure. Or you can actually have them kind of push down on the table with their foot, increase the pressure this way then, okay? Or you can push down like this. So again, not on the tibia bone. Okay, next one, I'm just going to bring it up here like this. And I'm going to go across the foot, but pull the knee towards me when I perform it then, okay? So you get to the top of the foot. Reflexology, this is more along the chest region. So especially smokers, it's going to be a little bit more tender. People that are upper chest breathers. Okay, next one, what I'm going to do is actually ask permission to sit on the foot, and you can actually grab a towel if you do have any lotion or oil in there so it doesn't get on your clothes. Just sit on their foot and kind of separate the gastroc then, okay? So you can actually put your fingers in the belly of the gastrocnemius and kind of separate it. Or you can go the other way too. But just always watch your reactions too. If it's too much pressure or if it's not enough, then they can actually incorporate a little bit of resistance with it then, okay? Okay, next one, you can grab the opposite leg. You can kind of pull it towards you a little bit. And the thing is, they can actually resist. Try to bring it this way. Okay, so go ahead. So you can go right across the peroneus region, or you can go up the side, right up the side of the peroneus. Or you can actually use your hip right here. Get a little stretch even with the TFL region. So you can go up there. You can even perform inversion. So inversion, remember inwards, inversion slide up, eversion nothing. Inversion slide up, eversion nothing. So you can incorporate that. And also right for the heel area, you know, like pray for pain. And rotate it around. And if you want, you can just have them slowly try to lift up their foot. Okay. You can increase it a little bit more. They want a little bit more pressure then, okay? So again, make sure you can use a towel in certain areas, so if you're going to have a lot of oil in your body. Okay. Next one, I'm just going to lift up the foot a little bit. And you can have them try to push down on the table and go right underneath the gastroc, any areas. You can even rotate the leg a little bit. So you can actually get it this way too, okay? You can even do a little bit of movement. A few seconds, get a little stretch.